Olá, meu nome é Maria Cláudia, estamos aqui com mais uma entrevista no AUA in situ, direto de Chicago. Estamos aqui com uma pessoa muito especial, uma grande amiga, Angie Smith, que é uma pessoa que traz para todas nós, mulheres na urologia, uma grande inspiração. So Angie, thank you very much for your time. I just introduced you in English and I said how wonderful you are and how we get inspired by you and all your achievement in urology. So for us women in urology, you mean a lot. So thank you for your time and for being here with us today. But what we want to do, the meaning of our project here is bringing back home the new messages from AUA for people who couldn't come. So you've been at the plenary for a very great talk about BCG. So we want to know what is the definition for unresponsive treatment on BCG and non-invasive bladder cancer?
Yeah, well, first of all, thank you so much for the kind introduction. I'm a big fan of yours, and I see you as an inspiration. So I just have to say that. Yeah, we had a plenary on BCG unresponsive disease, but in that plenary, I think it's important to highlight what the definitions of that type of disease are, because it's a very heterogeneous type of population. So the way in which we define the categories of BCG unresponsive disease is whether the patient recurred in a certain stage, so whether it was CIS or high-grade TA, high-grade T1, and the timing in which they recurred. And then the final element is how much BCG they received. So we define BCG adequate disease as those who at least had an induction therapy plus a maintenance or 2 induction therapies, with the exception of a patient who first presents with T1 disease, receives induction, and recurs again with T1. That's the highest risk category, BCG unresponsive 1B. There's another type, BCG unresponsive 1A, in which the patients had induction and maintenance, but they recur within 6 months. So that's a longer time course. They're still unresponsive, but they're in the 1A category. Then there is a whole other category on relapsing BCG unresponsive disease, which is more about patients who recur after induction maintenance, but more on this time span of 1 year or beyond, because that kind of category is more likely to respond to BCG again. And the reason the categories exist are for clinical trials and also for how we determine treatment.
So I know you are involved in a study about those kind of patients. What can we do next? What will be the next option for them? Can you comment a little bit about this?
Yeah, absolutely. We have, so John Gore, University of Washington, and myself, we co-lead a very large pragmatic clinical trial with 38 sites around the country in the U.S. and community sites, academic sites for patients who recur with non-muscle invasive bladder cancer after receiving BCG. And in that study, we allow patients to select either they undergo cystectomy, because that is one treatment, it's an effective treatment, or they undergo some kind of medical therapy. And what we're doing in that study, we have enrolled nearly 500 patients around the country. We are determining a variety of things, what salvage therapies we are using in practice, the efficacy of those salvage therapies, and also, most importantly, we're measuring patient-reported outcomes, how people are feeling, their quality of life, and also financial toxicity, how expensive certain medical therapies are. So I think this study is going to shed light on what treatment is the right treatment for a specific type of patient in their experience, drawing on the definitions, and we hope to be able to help guide patients and their physicians to select the right treatment at the right time.
Perfect. Congratulations on your work, and we really appreciate your time to be with us and give us this message.
Well,
thank you so much.
Thank you for inviting me.
Então, estamos aqui com mais uma entrevista. Espero que vocês tenham gostado e continuem conosco, nos acompanhando aqui no AUA in situ. Muito obrigada.